I am the student of Osh International Medical University. So today I will be discussing about the thalidomide drug. As you know that thalidomide drug, it is an anti-nausea drug which is a medication and was developed originally in 1950s. This drug was prescribed to pregnant ladies to alleviate the morning sickness. It was found that after taking this drug, some of the defects were seen in babies, which includes the limbs, malformations, and the other organ damages. After that, during pregnancies, it results thousands of children were born with this defect around the world. It's also been found that thalidomide drug also has an beneficial effect on immune system, inflammation, as well as the growth of blood vessels. Some of the mechanism action of the thalidomide drug includes the anti-inflammatory factor. The thalidomide drug, it reduces the inflammation by inhibiting the production of certain cytokinins. Also, the second mechanism action includes the anti-modulatory factor. Thalidomide drug, it also modulates the immune cells by enhancing the activity of immune cells like natural killer cells and T cells. Also, the third mechanism action is angiogenic inhibition, in which the action of the protein cells is blocked. The fourth mechanism action is the tumor cells. Thalidomide can directly inhibit the tumor cells. The fourth mechanism action is the sedative effect. So, due to the sedative effect, it was taken as sleeping pills previously. Now the therapeutic uses. This drug, thalidomide drug, it is nowadays used to treat various types of cancers and other diseases also. Like it is nowadays used to treat the multiple myeloma. Multiple myeloma, it is actually a disorder in which the plasma cells are defected, which are present in the bone marrow. The second therapeutic use is it is used in to treat the leprosy. Leprosy, it is actually a chronic infectious disease which is caused by Mycobacterium leprae. It is also used to treat the Crohn's disease, and also it is used to treat the lupus also. Some of the side effects include, actually the side effect of any drug, it depends upon the dose and duration of the treatment. So the some of the side effects of the thalidomide drug includes bird effect. And the bird effect.
Assalamualaikum, myself Mashalare. Today my topic is amoxicillin. Amoxicillin is a penicillin group used to treat bacterial infection. Amoxicillin is one of the most commonly used antibiotics for children. Amoxicillin is properly known as amoxil, trimox, moxilin, and novamox. A condition for which amoxicillin is prescribed: urinary tract infection, respiratory infection, Lyme disease infection during pregnancy. Prevention of bacterial infection, skin infection, ear, nose, and throat. Amoxicillin is available in various dose tablets, capsule, powder for oral suspension. Amoxicillin can be prescribed in combination with the following. Amoxicillin is also prescribed to treat pyloric cause of pyloric ulcer infection in combination with. How to take amoxicillin? And the usual adult's overdose is 500 mg taken by mouth with food 3 times daily for a period of 7 days. The dose and duration may vary in children and adults depending on infection. What are the common side effects of amoxicillin? What prescription need to be taken? And the use of an additional contribution to oral pills is advised. Do not use diarrheal medicine without doctor advice. Take exactly is prescribed. Complete the full course. How should you not take an amoxicillin? Amoxicillin to penicillin group drugs disease, severe kidney disease for viral infection.
Good evening, everyone. A warm greetings and welcome from my side. Myself, Kirtana, belonging to Group 2A of Osh International Medical University. Today, I'm going to present this presentation of azithromycin, and I'm presenting this presentation to my teacher, Dr. Faisal sir. And in this presentation, I'm going to talk about azithromycin, the class of the drug, source, action, indication, dosage, clinical application, uses, mechanism of action, therapeutic use, diagnostic use, effect of drug, contraindications of drug, pharmacokinetics, pharmacodynamics, drug to drug interaction, process of absorption, bioavailability, and half life. So, firstly, what is azithromycin? Azithromycin is a widely used antibiotic against many microorganisms, including Staphylococcus, and mainly it has a wide spectrum of pharmacokinetics, better tolerability, and drug interaction amongst them. And it is mainly used against curing many of the infections like bacterial infections and even sexually transmitted diseases. And the trade name of this drug is Zithromax, Azithromycin, and others. The other name of this azithromycin is 9-deoxy 9-alpha aza 9-alpha methyl 9-alpha homoazithromycin A. The route of administration. Azithromycin is given by mouth, that is in the form of capsule, tablet, or suspension. Then it's given in the form of IV injection, and even in cases of eye infection, it is given in in the form of eye drops. The class of this drug include macrolide antibiotic. The bioavailability of this drug includes 38% for each 250 mg of capsule, and the metabolism mainly occurs in liver. The elimination of this half-life occurs generally from 11 to 14 hours for a single dose, and it widely differs from for multiple dosing among 6 to 8 hours. And the excretion is done in the organs like bile, duct, and kidney. The formula for this azithromycin is C38, H12, N2, and O12. The molar mass of this azithromycin is 748.996 gram mole inverse. The 3D model is interactive image. First, we're going to talk about the class of drug. The class of drug includes macrolide. The macrolide or class of drug that are used to treat many bacterial infections, and they are commonly used to treat infections like pneumonia, sinusitis, and tonsillitis. They are also used in uncomplicated skin infections such as otitis media in pediatric patients. And source of this azithromycin. Azithromycin is an azolite, a subclass of macrolide antibiotics. It is derived from erythromycin with a methyl substituted nitrogen atom incorporated into the lactic ring, thus making that lactone ring 15 membered. It prevents the growth of growth factors. Actually, what it does is this structure of this azithromycin prevents the further growth of this bacteria. Action of this drug. It includes the inhibition of bacterial protein synthesis. This action of this drug, what it does is actually it will go and kill the bacteria, and it will thus it is preventing the further growth of this bacteria. Thus it mainly involved in the cytokine protection, and it inhibit the neutrophil infestation and macrophage polarization. And alteration given it has the ability to act against a wide range of microorganisms. This azithromycin is used against a wide range of microorganisms. And indication of this drug. The other indications of drug of azithromycin includes tonsillitis, sinusitis, and others, and they are mainly used in
Hello, my name is Dr. Dilavanin, second year, third A group. Today we are going to talk about hydrocortisone. So first of all, we talk about the history of hydrocortisone. Hydrocortisone is a synthetic form of cortisol, a hormone that is naturally produced in the adrenal gland of the body. It was first synthesized in the 1930 by a group of researchers led by Edward Kendall, who later won the Nobel Prize in Medicine for his work on hormones of the adrenal cortex. Hydrocortisone was first used medically in the 1940 to treat rheumatoid arthritis and later became a widely used medication for a variety of inflammatory conditions. And then the hydrocortisone has been extensively researched over the years, particularly for its use in treating skin conditions such as eczema and psoriasis. A study published in the Journal of the American Academy of the Dermatology found that hydrocortisone cream was effective in reducing inflammation and improving symptoms in patients with atopic dermatitis. Another study published in the Journal of Investigative Dermatology found that hydrocortisone cream was effective in reducing skin inflammation in patients with psoriasis. So now what is hydrocortisone? Hydrocortisone is a corticosteroid hormone that is used to reduce inflammation and swelling in the body. It can be used to treat a variety of conditions including skin conditions, allergic reaction and autoimmune disorders. So hydrocortisone is a steroid hormone that produced naturally in the body by the adrenal gland. It is also available as a medication in various forms, including creams, ointment, tablets, and injections. So let us discuss about the mechanism of action. Hydrocortisone is a corticosteroid hormone that works by binding to specific receptors in the cytoplasm of cells throughout the body, including immune cells. Once it binds to the receptor, it enters the nucleus of the cells and binds to DNA, which leads to the suppression of the transcription of inflammatory genes and the production of inflammatory proteins. Hydrocortisone is a corticosteroid hormone that works by binding to specific receptor in the cytoplasm of cell throughout the body, including immune cells. Once it binds to the receptor, it enters the nucleus of the cell and bind to DNA, which leads to the suppression of the transcription of inflammatory genes and the production of inflammatory proteins. Hydrocortisone also suppresses the activity of immune cells such as T cells and macrophages, which play a crucial role in inflammation. So let us discuss about the uses of hydrocortisone. Hydrocortisone is a medication that is used to treat various medical conditions such as skin inflammation, allergic reactions, and autoimmune disorders. It is available in different forms including creams, ointments, tablets, and injection, and can be purchased over the counter in lower concentrations or by prescription in higher strengths. Hydrocortisone is a corticosteroid hormone that works by suppressing the immune system response to inflammatory and reducing the production of inflammatory chemicals in the body. So let us discuss about the side effects of hydrocortisone, because excess of everything is bad. Like all medication, hydrocortisone can cause side effects, although not everyone experiences them. Common side effects of hydrocortisone include skin irritation, redness, itching. Long-term use or high doses of hydrocortisone can lead to more serious side effects, such as thinning of the skin, increased hair growth, acne, and changes in skin color. In rare cases, hydrocortisone can also cause more serious side effects, such as increased risk of infection, osteoporosis, and adrenal suppression. Let us discuss about the antidote in case of overdose. Hydrocortisone overdose is rare, but it can occur with long-term use of high doses of the medication. It If an overdose of hydrocortisone is suspected, medical attention should be sought immediately. There is no specific antidote for hydrocortisone overdose, but treatment may involve supportive care such as managing symptoms, monitoring vital signs, and administering fluids. So, this is all about hydrocortisone, and thanks for your attention.
We're gonna talk about the GLP analog. In this, we will learn about the GLP analog and mode of action of GLP analog. And in this video, we will learn about the side effects and adverse effect of the GLP analog. Let we start from the introduction. GLP analog is a abbreviation of glucagon like peptide receptors. It is an incretin secretory molecule. GLP-1 analog receptor antagonists are widely used in the treatment of the diabetes type 2 due to their attributes such as the body weight loss, protection of islets beta cells, promotion of islet beta cells proliferation, and the minimal side effects. Studies have found that the GLP R1 is widely distributed on pancreatic and other tissues and has multiple biological effects such as reducing neuroinflammations, promoting nerve growth, and improving heart function, suppressing appetite, delaying gastric appetiting, and regulating the blood lipid metabolism and reducing fat deposition. In the actions of the GLP antagonist promote the first phase of the insulin secretion, reduce glucagon release, weak safety effect, and thus lowering the blood glucose with a modest weight loss without hypoglycemia. GLP-1 analog reduces the symptoms of high blood glucose levels, such as feeling thirsty. In this long-term, good control of the blood glucose level reduces the risk of the developing problems with your eyes, kidneys, and feet. Some GLP-1 analogs have also been shown to have additional benefits in protecting against heart disease and stroke. Mode of action of the GLP analog on brain, heart, GI tract, pancreas, and liver. In brain, synaptic transmission increase, nerve protection increase, memory also increases, motor function also increases. Whereas the heart, cardiovascular protection increases, heart rate increases. In liver, liver glucose production, liver fat content decreases. In pancreas, insulin synthesis increases, insulin secretion also increases, whereas blood glucose level decreases. Whereas GLP-2 analogs CNS neurons activation to trigger a pathway leading to decrease the HPG. Glucose incorporation increases, inflammation decreases, whereas in liver improvement of the hepatic function related to glucose or lipid metabolism. In treatment, use least expensive agents. Continue with the metamorphine or pioglitazone. Add SGL2 inhibitor if the postparental hyperglycemia. Move from the lixisenate date and extend date to a glutate. If neurosis or suboptimal response. Side effects of the GLP-1 analog. The use of GLP-1 receptor antagonists are the gastrointestinal symptoms, mainly nausea. Other common adverse effects including injection site reaction, headache, nasopharyngitis, but these effects do not usually result in the discontinuation of the drug. Current evidence shows that the GLP-1 analog receptors antagonists had no negative effect on the cardiovascular risk of the patients. Thus, the GLP-1 receptor antagonist appears to have favorable safety profile, but ongoing trials will further assess their cardiovascular effects. And this is all about the GLP-1 analog, its mode of action, and its adverse effects. Thank you.
Good evening, everybody. My name is Amisha. I'm the student of Ocean International Medical University. I'm in second year, 2A group. Today we are going to discuss about a drug called hydrocortisone. In this lecture, we are going to tell about its class, mechanism of action, diagnostic uses, therapeutic uses, side effects, adverse effect, etc. So let's get started from the classes. Class of hydrocortisone. Hydrocortisone is in a class of medications called corticosteroids. It works by the activating natural substance in the skin to reduce swelling, redness and itching. Next is mechanism of action. The mineralocorticoid, aldosterone and the glucocorticoid, cortisol and the corticor are produced uniquely in the adrenal cortex. These steroids act by binding to intracellular receptors, which then act to modulate gene transcription in the target tissues. Therapeutic uses. Hydrocortisone is a steroid medicine. It's called corticosteroids. It works by calming down your body's immune response to reduce pain, itching, and swelling called inflammations. It is also used to be a hormone replacement for people who do not have enough of natural stress hormones like cortisol. Diagnostic uses. Hydrocortisone tablet work as a hormone replacement for a natural hormone called cortisol. You may take hydrocortisone tablet if your body does not make enough cortisol. For example, if you have addiction disease or if you have your adrenal glands take out, you can use this medicine. Side effects of the hydrocortisone. The most common side effects of hydrocortisone tablets are feeling dizziness, headache, swollen ankles, and feeling weak or tired. Taking hydrocortisone tablet can affect your immune system, so you are more likely to get infections. Adverse effects. It can cause serious side effects such as adrenal glands problems, high blood sugar, hyperglycemia, like that, or problems with your eyesight. It will affect our eyesight also. Contraindications. Inactive tuberculosis, herpes simplex infection of the eyes, an infection due to a fungus, intestinal infection caused by the roundworm strongyloids, a condition with low thyroid hormone level, insufficiency of the hypothalamus and pituitary glands. Drug to drug interactions. You should tell any doctor or dentist treating you that you are taking steroids. Some key drugs that interact with steroids including anticoagulants such as warfarin, drugs for blood pressure, antiplatelets, antidiabetes drugs, antifungal drugs, bronchodilators such as salbutamol, and diuretics. Thanks for your attention. Thank you so much.
Facts of cephalosporins. These drugs are active against Haemophilus influenza, Escherichia coli, Klebsiella pneumonia. Next, the two types of cephalosporins are oral, intravenous. Oral is a mild infections and the intravenous is a severe infections. It can treat depends upon the infections. It oral it means example sore throat. Uh, Next, intravenous means it interact with the tissue directly and it's pure and higher concentration than oral microbial, antimicrobial. We already tell about cephalosporin can fight against the bacteria. Its bacteria is fight two types, gram-negative bacteria and gram-positive bacteria. It depends upon the infections. Cephalosporin can interact with the gram-positive bacteria and gram-negative bacteria in some generations. In most commonly, it interact with the gram-positive bacteria. The cephalosporin used to treat gram-negative bacteria. Thank you. Everyone, I am Dr. Aishwarya. I am going to explain about cephalosporin mechanism. It's a large group of bacterial antimicrobial. It fight against bacterial infections. Beta-lactam binds to penicillin binding protein and inhibits normal activity. Cephalosporin is similar to penicillin. It fight against gram-positive and gram-negative bacteria. Therapeutic uses. It treats skin infection, meningitis resistant bacteria. Next, diagnostic uses. Its skin and skin structure. It's a tissue. Otitis media. It means ear infections and respiratory tract infections. Urinary tract infections. Its side effects, it's nausea, it's most common, and lack of appetite, abdominal pain. Next, the adverse effects of cephalosporin. Eosinophilia, thrombocytosis, fungal infection, itching, vomiting is a common. One of the most contradictions of cephalosporin is if patients are allergic to them or had an anaphylactic reaction to penicillin or other beta-lactam antimicrobials. Next, the lack of activity against enterococcus, lack of activity against methicillin resistant. Next, the drug-to-drug interactions. The drug-to-drug interactions, what it causes. A cephalosporin can interact with certain medications and supplements such as metformin, warfarin, zinc. It may also interact with the liver cholera and typhoid vaccines. If drug-to interactions, it combination in when cephalosporin is combination with aminoglycosides, it can damage also kidney. Interesting facts of cephalosporin.